Okay, we're back live. Sorry about that. Looks like I was having some technical difficulties. Hopefully, I'm back up running now for you all, and bear with me. So, if there's any problems, certainly let me know. But hopefully, we're back up and running. So, let me go back since I was having some technical difficulties. I'll go through some of the report from the MRC email. There are 69,087 confirmed positive cases of COVID-19 in the Commonwealth, with over 1,000 new cases and 4,090 deaths as of yesterday at 4 p.m. That 1,000 caseload is the lowest amount we have seen in almost a month. Overall, there are over 324,000 tests that have been conducted by public and private resources. 10% of the 9,622 cases reported today were positive. 3,539 individuals are hospitalized with COVID-19 statewide, and that's a drop of 78 from the previous day. Department of Public Health has regularly released a daily reporting dashboard containing detailed information, and hospital capacity as of May 4th. 53% of the Commonwealth's 17,900 permanent and temporary hospital beds are available for new patients, and that was as of yesterday. Mobile testing, the Massachusetts National Guard Mobile Testing Unit continues to visit and conduct tests at the Commonwealth's long-term care facilities, having made 542 visits and conducted 29,417 tests as of May 4th. All Massachusetts residents are being encouraged to answer the call if and when they are contacted by the Commonwealth's growing contact tracing operation. If someone tests positive for COVID-19, the community tracing collaborates contact tracers will reach out by phone to that person in their close contacts to slow the spread of the virus. Contact tracers will make sure residents are getting the medical attention and support they need during isolation and quarantine. Caller ID will show the call is coming from MA COVID team. That's MA COVID team. Information shared during the call is strictly confidential and is treated as private medical information. And as far as the economy goes, the Reopening Advisory Board continues to meet with stakeholders and consider input from all over the Commonwealth and across every sector of our economy. The board is also soliciting public online comments when business owners, workers, state officials, and others may have valuable perspective to offer. So, as far as the public online comment goes, we actually have access to that on our own town website. You can go to www.foxboroma.gov, and we can give you that, and that information will be available to you there as well. Senate from legislative side, Monday, the House of Representatives adopted historic emergency rules to hold sessions remotely with unanimous bipartisan consent to ensure that we can continue to advance the legislation essentials to our health, safety, and economy. Temporary emergency rules can be read online from the mass.gov website. And the Senate passed legislation allowing for modifications to quorum requirements for town meeting during the pandemic. The bill now travels to the House of Representatives for consideration. And a reminder that this week, statewide executive order required face mask coverings for all individuals in public spaces where social distancing is not possible goes into effect. Those who are frontline workers those who are frontline workers with family members who are encouraged to visit frontlinema.gov, Frontline MA, the Attorney General's statewide website for frontline workers support resources and information, and resources for residential experience job loss or loss of income. COVID-19 is causing major disruptions in the economy, which is affecting incomes of many residents and families. There are a number of state resources and supports available to support workers who may find themselves unemployed or otherwise income constrained during this uncertain time. And additional guidance on unemployment assistance, updated guidance for self-employed individuals and those who have exhausted existing benefits is available online. Massachusetts Employee Unemployment Benefits FAQs is also available online, and the Department of Unemployment Assistance virtual town hall schedules can also be accessed online as well. So we do not. So I had a question this morning. It was, are there any of our hospitalized folks in ICU? I know of one individual personally, but I do not know of any others at this point in time. So and I obviously I can't divulge the name of those individuals, but I know of at least one at this point in time. That's the only person I'm aware of. The Department of Public Health is hiring up to 1,000 people to do contact tracing. Applicants should be fluent with technology, and multilingual applicants are encouraged to apply. The American Red Cross is asking for blood donations, the need for which is significant due to blood drive cancellations. The need is dire due to cancellation of hundreds of blood drives throughout the Commonwealth, and people can call 1-800-RED CROSS to access that information. So let me just then also go to another area of information that I wanted to just share with you. This comes directly from the Boston Globe, where they provide you a what you need to know access. And so if some of this information is quite interesting. What I've seen, the CDC models predicts daily deaths will double by June 1st. But there is differing stories about what's been happening with that information. So we're going to have to wait and see what shakes out with that. But I think there is different perspectives on that information. So that keeps being reported, but also there are different reports coming out about how that information was collected. And it says that so the Gilead drug could generate $2 billion in sales. Remdesivir, a drug developed by biotech Gilead Sciences, is being used to treat severely ill coronavirus patients, in which with each round of treatments going for as much as $4,500, which is very expensive, obviously. That price is considered reasonable according to some analysts. Mass hospitalizations are dropping over the past several days after Massachusetts officials reported nearly 16,000 newly processed coronavirus tests on Sunday. In the highest single daily total so far, the Governor Charlie Baker said yesterday that the hospitalizations for coronavirus have decreased over the past several days. Of the tests performed, the percentage of positive cases has also been dropping in recent weeks. Meanwhile, Massachusetts researchers are leading the charge on antibody testing, which is great to see, and that is being done throughout the Commonwealth, and also being done right at UMass Medical in Worcester. So if anybody who's interested in participating in that, feel free to contact them. If you know you've had COVID-19, you can actually donate your plasma for consideration and using with some of the most ill patients who are currently dealing with COVID-19. That can actually is found to be very helpful in helping those folks recover. So if you're interested in participating in that program, you should reach out to UMass Medical in Worcester, and they will help you with that. Also, paging 311 will have a social distance we have a social distance non-follower. Boston's 311 system experienced a spike in social distancing reports over the weekend as people rushed outside to enjoy the beautiful weather, sometimes evading social distancing and mask wearing guidelines. So again, very, very important that we maintain those guidelines and to stick with those, and start to make sure that we are using the mask starting effectively tomorrow when the governor's rules go into place. Childcare centers are experiencing some very difficult times, and many of them are shut down currently. So due to the fact that there are strict limitations on that, I know that certain areas are providing daycare for those, such as the local YMCA in Foxboro is providing daycare for those folks who are considered essential. And if anybody has any questions or if they need daycare, you can contact the Hockomock Y in Foxboro. They will certainly help you with that information and maybe provide you some service as well. So preparing for summer. So how does it look like? How does social distancing going to be looking like on Cape Cod? Is that even possible? The answer to that question will likely shape what our summer looks like, particularly for seasonal residents. Businesses on the Cape are already feeling the effects of the pandemic and hoping for the best, hoping that at some point, some level of normalcy will return under the new normal. And so those are some of the key headlines that I've noticed. I noticed that even the NFL has canceled has canceled its London and Mexico City games, and they're going to be brought back to the U.S. So those games will be played here in the stateside. So I guess that's not a surprise to anyone, given the fact that any international travel is strictly limited at this point. And let's see. So let me see. I think that's it. Those are the key things that I've picked up over the past 24 hours. I'll continue to look for some really interesting stories to share with you if I can find them. And I want to say thank you again for joining me today. Hope you're staying well. Hope everything. I'm broadcasting live from my home this morning. I've been rotating with Mike Johns, the assistant town manager. Mike's day is in the office today, and my day back in the office tomorrow. So we're trying to keep our own social distancing practices in place, and hope that you acknowledge the fact that we are trying to do our part in keeping our office safe, and hope that you continue to do the same as well in your own practices. So I want you all to stay healthy, stay well, and I'll continue to be back here again tomorrow morning at 10 o'clock, roughly around 10 o'clock. I've been off a little bit. I was off a little bit this morning because I had another meeting this morning, but I will certainly be back at some time tomorrow morning, roughly around 10 o'clock, to give you the latest update on what's going on in and around Foxboro. Until then, stay well, stay healthy. I'll see you next time.